Before we get going, I want to start by expressing my sincere thanks to our current Executive Director of Public Safety, Murphy Robinson. You know, during his time with our administration, Murphy always rose to each and every challenge or opportunity he had before him. He started as Director of Department of General Services, then served as the Chief Operating Officer in the Mayor's office, and finally as the Head of Public Safety during one of the most difficult times for our community, helping to lead us through the pandemic and through the summer of 2021's protests and riots. Whatever the topic or the issue, Murphy brought a great sense of energy and collaboration as a bias for problem solving. I will miss him, but I wish him well in whatever he chooses to do next. He also put together a great leadership team within the Department of Safety, and we didn't have to go far to find our next public safety director. Today, I'm proud to announce that I am nominating Assistant Deputy Executive Director Armando Sadate to be the next Executive Director of Public Safety for the City and County of Denver. Armando joined the city team back in 2014 as a senior investigator, later civilian commander for the Denver Sheriff's Department's Internal Affairs Bureau, an outcome that was part of the department's reform effort. He joined the Department of Safety in 2018 as a performance improvement manager and rose to being named Assistant Deputy Executive Director earlier this year. As an example of Armando's leadership, when we began to devise an early intervention team to provide a more efficient, effective, and alternative response to non-criminal calls about homeless encampments, Armando took on the task of forming the program and ensuring that when it was stood up, it was ready to respond with a person-focused human services approach. Similarly, he has helped to create a new street enforcement team, which is providing a non-uniform alternative response to lower level crimes and freeing up valuable time for uniformed police officers. Before coming to Denver, Armando spent over 2 decades as an officer with the Phoenix Police Department and federal task force officer with the FBI's Phoenix Division. That mix of law enforcement experience, diversity of professional background, and collaborative approach, his task force approach to public safety makes him a natural fit for this important role. With Armando at the helm, as we enter this new year, building on what Murphy and many others have helped create, we are going to sharpen our focus even more on improving public safety and addressing crime. We have already, in my view, established Denver as a national leader and a model for other cities to follow. We are leading the way in providing alternative responses that get people in crisis the help and services they need while allowing uniformed officers to focus on crime prevention and keeping residents and neighborhoods safe. Clearly, we have much more work ahead of us, and I know we are up to the challenge. This year's budget includes funding for more police academy classes so we can get more officers on the beat. We will build on our partnership with the state to expand our diversion and intervention efforts and address the opiate crises on our streets. Armando is ready to take on these challenges. And I also have tasked him with reviewing our public safety programs and initiatives to see what is working, what is not, what needs expanding, and what more can be done. I look forward to working with members of City Council during this confirmation process. With that, it's my pleasure to turn it over to our nominee, Armando Sadate. Armando?
Thank you, Mr. Mayor. I appreciate the introduction. Yeah, it's an honor to have this opportunity to serve the Denver community as Executive Public Safety Director. I want to take the moment to thank Mayor Hancock, his staff, for choosing me for this role and trusting me with this great responsibility. I also have to give special thanks to our outgoing Executive Director, Murphy Robinson. His exemplary leadership over the past 2 years during really unprecedented times and challenges that we faced in safety, really was a really good model for me as a leader, and I really appreciated his mentorship and his help in me grow into this role. I also have to thank my family for their support of me accepting this position. I come from a family of public servants. My dad was a cop for over 40 years. My mother retired after a long career in federal government service. And my 2 siblings, they still currently work in the federal government where they have served long careers. I think it's fair to say I was raised to serve. I have to thank my wife and daughter We made this decision as a family, recognizing the sacrifices it involves. Without their support, I just wouldn't be here. Given my extensive background in public safety, I recognize the immense challenges that our agencies face each and every day. Coupled with the ongoing COVID-19 pandemic and rising crime, the issues our public safety personnel are grappling with will require a collaborative, conservative effort to address. I've always made it a priority to listen to our communities and will take thoughtful, strategic action as executive director. Our department understands that the services and resources that we provide are inherently personal, and as public safety impacts each of us. We want each person to feel safe as they walk through their neighborhood, drive to work, enjoy our downtown. Personally, I've heard and engaged with many community members and groups in my previous roles here with the city. I understand and hear your frustrations. I will commit the Department of Safety to engaging more with the community moving forward. While public safety is something that impacts each of us, not everyone engages with our department. We look forward to elevating those voices who are not part of our public safety dialogues right now. And that's something that is very important to me. We're here to serve, and I'll work to gain your trust as will the leaders of our agencies and our staff. Transparency and honesty will be demanded of our agencies under my leadership. And I know you are concerned about crime in Denver. While we're seeing an uptick in crime across major cities in the United States, what matters is what's happening now in our city. It is unnerving for me to see news stories of shootings and robberies each week in our city, and it is unfortunately a very complex issue to solve. We need to restore order in our city while providing valuable resources to those who are struggling in our communities. We know we're not going to arrest ourselves out of this, and you'll probably hear that from me often. It's something that I learned very early in my police career, which is why we need to be more strategic about how we respond to crime and issues like personal recognizance bonds, or PR bonds as they're referred to now, and that issue of pretrial detention. Those that are a significant threat to our community, I just want to be real clear on this, should not be granted PR bonds. Additionally, we need to connect those with proper services within our system to ensure when they are released from custody or from a pretrial detention, that they have the ability to re-enter society in a productive way. There's been a lot of conversations about how PR bonds are issued and why they're issued and who they're issued to. With problems like PR bonds, we need to understand the data to determine where the system and policies are failing. I'm going to make sure that our departments are on the same page about the issue, the data, and what actions we need to take to ensure that PR bonds are having their intended impact without unintended consequences. I understand that policing and police resources are central to the public safety discussions many of us are having. As a former police officer, I've thought long and hard about what we can do to improve police response within Denver. Initially, I want to focus on 3 areas of policing, but it's really not limited to these 3 areas, but I want to highlight those for you today. First, we have to ensure we have adequate staffing. We have seen fewer applicants for our police academies, and we need to bolster our recruiting efforts to bring in the best candidates that are also representative of the community we serve. Next, we need to be innovative and think strategically about the resources available to us. Initiative like STAR, Supported Team Assisted Response program, Early Intervention Team, and Street Enforcement Team that the mayor mentioned, allow for alternative responses to calls for service that free up police resources. It is imperative that police are able to respond to 911 calls in a timely manner, and analyzing where else we can deploy non-police resources is critical to making that happen. Homelessness is arguably the most visible concern facing Denver today. I've spoken with, I think, some people on this call about this issue directly. I have responded to many encampments, interacted with countless individuals experiencing homelessness, and overseeing our street enforcement team that interacts with unhoused folks daily. We need to focus on making tangible changes that are going to provide resources and opportunity to these individuals. Drug use, especially fentanyl, is another major concern on our streets. It's another complex issue that's not going to be solved overnight, nor is it something we can arrest our way out of. It's a concern in all of our communities, and we need to focus efforts on addressing the epidemic of drug use in Denver. I also want to mention my support of current harm reduction efforts in our city. These two issues highlight the intersection of public safety and health. The two are deeply intertwined. It's time that we take a public health lens to the work we do in public safety, including on the streets, in our jails, and in the programs that we offer as a city. There's no one solution to solving these issues, but we can take an informed, data-driven approach to incorporating public health into our departments to meaningfully impact those who we serve. Last week, our communities experienced incredible tragedy with the shootings that took place in Denver and Lakewood. There's still many questions that we are actively working to answer, but I want to assure you that we are taking appropriate action to examine our practices. At the direction of Mayor Hancock, we are completing a comprehensive review of the situation, investigations, policies, and responses taken by our agencies in this matter. We will share our findings as the review progresses. In closing, I just want to we face a lot of tough challenges today. I want to acknowledge the trauma our community has suffered, from the COVID-19 pandemic to violence that has claimed and impacted far too many lives, to the devastation our neighbors have experienced with the Marshall Fire. We will only get through this if we work together. Whether you're an abolitionist or you want to get tough on crime, I invite you all to help by sharing your ideas and being a partner to our department. The Department of Public Safety will be at the table with you to work to make Denver safer for everyone. And with that, I'd love to answer your questions.
Thank you, Armando. We'll go ahead and turn it over to you, Teresa, if you will facilitate, or Gabrielle, facilitate the Q&A.
Sure, Mayor, thank you so much. Sure. And let's start with Julia from the Gazette. Julia, do you have a question?
Sure. I guess to start out, what is the salary for this position?
Yes, I'd like to ask a question.
I'm sorry. Hang on one sec, Tone. I'll call you in just a second. We're with Julia first from the Gazette, and I'll get you on there, Tony. Just hang on one second.
Thank you.
The question was what the salary is for the position. Unless Armando, you know it right off the top of your head. Let us go ahead.
I think I know because I just signed the letter the other day. I believe it's 168,000. There may be some.
There's a delay here.
I think I know because I just signed the letter the other day. I believe it's.
Thank you. We'll get the exact number out to you all in just a moment.
Okay, I think I'm hearing some echo, but I did hear the answer, so I'll let somebody else go next.
Okay, sorry about that. We just had somebody joining, and everybody check and make sure you're on mute, and then you can star 6 to unmute when it's your time to ask a question. Esteban. Esteban, are you still with us? And do you have a question? Let me unmute him.
Hi, Mayor. Hi. I was my question was with the street enforcement team. Armando, you told City Council about the size of it, being 6 people. Are you planning on expanding that, on growing it, on adding additional teams, or making that team larger?
Yeah, thank you for the question, Esteban. Yes. So last year's budget cycle process that dictates what we can spend this year, thankfully, City Council did approve an addition of 6 members. So that's basically doubling the size of the team. What that's going to really impact us is it's going to allow us to move to a 7-day-a-week coverage. So I've already worked through scheduling and hiring for that new team, and every industry is having trouble hiring, but we're looking to get that started right off the bat.
Thanks, Esteban. Let's go to Elise from the Post.
Hello, my question is, you mentioned that you support harm reduction efforts in the city of Denver, especially as we're seeing this horrific spike in overdoses and overdose deaths. Do you support the establishment of a supervised use site in the city of Denver, and why or why not?
Yeah, I'll answer the first part of that, Mayor, and then if you want to weigh in as well. So thank you, Elise, for that that question. And it is important for me to acknowledge harm reduction. I see it every day. There's a lot of harm reduction efforts out there. There's a time I'll go to an encampment, I'll see improperly discarded needles, and I'll call Lisa at Harm Reduction Action Center and ask her to get out there. And her outreach team and my outreach team have worked together collaboratively, and they help with our harm reduction and educating, providing folks that are addicted and using drugs that we know that's going to happen, that you know, giving them the resources that they need that me as a street enforcement team cannot deliver. So I do appreciate that, and I do recognize people dying in our streets. The team I lead, we walked into an encampment where a young person died of an overdose. And it's very impactful, it's very traumatic, and we have to do everything. And I know this city's committed to doing everything to reduce that. The issue of safe injection sites is actually one that's come up that we've all discussed with the recommendations to reform public safety and policing provided by the task force that was a community involved task force. One of those 112 recommendations is regarding safe injection sites. So it's really not one person to support or to talk about or give their opinion on. What I'm saying is that it's multi-level. We have public health that needs to weigh in. We have this. I know our city has looked at other jurisdictions that have this. New York has it. So can we learn from them? But we're also under a state legislative thing that limits us to what we can. I'll take you guys back maybe a few years now. I'm not exactly sure the time, but our council did approve it. They have approved the setting up of these. So it's something where we're addressing formally in our response to the recommendations from the task force. And that's a citywide approach. So singularly, I don't want to answer that. But Mayor, do you want to add anything else there?
The only thing I'll add is two things. One is to remind us always with regards to harm reduction that it's a tool chest that we have to keep as diverse and as thoughtful as possible as we approach whatever the challenge is here with regards to the opiate epidemic that we are seeing in our city that's devastating our communities right now and devastating lives. Secondly, with regards to safe injection sites, as you alluded to, Armando, and we all know, there are a myriad of challenges for a safe injection site in Denver, and nothing less than what you talked about, Armando, in terms of the state legislation, our legislature, as well as the federal government being a barrier. So, while we may look at it, it's important that we not corner ourselves with just one or two options. We need to be looking at a myriad of options in this tool chest because this problem is huge and it's not going away anytime soon.
Thanks, Mayor, and thank you, Armando. Tony Kovaleski. *6 if you're still on to ask a question. Don't think we might have lost Tony. Anyone else that I missed from the press who's on the call right now? Or any follow-up questions?
This is Juliet at the Gazette. I do have one more. I do have another question, if that's all right.
Go ahead, Juliet.
So I understand that you have been acting as you've been communicating with the Citizen Oversight Board for developing a new system for tracking complaints to the Sheriff's Department. And I know that was within the last couple of weeks. And I wanted to ask, are you still going to be the liaison for the Citizen Oversight Board as that process is implemented, or what is your role in that going to be going forward?
Yeah, thank you for that question. So Julie, I had a good conversation yesterday with Julia Richmond, the chair of the Citizen Oversight Board, to discuss just that. First of all, there was when Murphy announced his departure. Just prior to that, I was on a call with them in one of their meetings and Murphy, and we made a commitment that we were going to take every complaint that came into our into the DSD that came into our administrative investigative unit at the Public Integrity Division, that it would be entered into one singular database, which is IA Pro, and that which has oversight from the monitor and has access. We also gave access to our Citizen Oversight Board to that same database. And hopefully this would offer greater transparency of how we triage cases and choose those cases that will have investigations. So that was something that I've been part of since, it really dates back to when I first got hired here at the city in 2014 in that, a reform role of internal affairs practices. And through that, I stayed involved under the former director, Troy Riggs. He appointed me to lead the executive advisory board, and that was a community and employee involved board where we tried to establish policies for this. That effort was a little diverted because Murphy came on and then the pandemic hit, but we continued that interaction with folks, and this was a central issue that we never quite resolved until recently when we made that commitment. So one thing I conveyed to Julia, and I'll continue to convey to the Citizen Oversight Board, is we want to work closely with them as a partner. As an executive director of safety, I am there to brief them. I am there to keep them in good communication. They're a close partner. We have a formal, our formal liaison is our community and government affairs manager, but I made her and the board that they are accessible to me to continue that dialogue and partnership.
Yeah, thank you.
I'm going to try one more time. Tony, are you back on the line?
I am, Teresa. Can you hear me now?
We've got you. Go right ahead.
Okay, two-part question for both Mr. Mayor and Mr. Soldate. First one, can you share specifics about what you're asking or looking for in regards to the post-Christmas shooting spree in Denver and Lakewood? And the second part of the question is, in recent weeks, Murphy Robinson announced an inquiry, a review of the Denver Health Paramedics Division and the culture that we've reported on of forcing paramedics, encouraging paramedics to bypass other level 1 trauma centers and return critically injured patients to Denver. Appreciate responses from both of you on both questions if possible.
Sure. Mayor, do you want to go first or would you like me to?
No, go ahead.
Okay, so yeah, thank you, Tony, for the question. So first on the Denver Lakewood shooting review, it's going to be comprehensive. It's not going to be limited to one aspect, one component. We're going to look at everything from the first call, and I think there were reports yesterday about the first call that came in from a person in Germany to how we responded to that call, how it was handled, to how it was transferred over to the Bureau, and everything that Denver touched with this call, we are going to look at. To, like I said before, did we act appropriately within our procedures, guidelines? What did we know then? Again, we have to keep in mind, we're looking at this through the lens of hindsight. What did we know then? What did we know? Are there things now that we've learned that maybe we could have done differently? So it's really going to be comprehensive. I don't want to say we're just going to look at one thing because that's not happening. We're looking at everything. And I got to mention the police department is very active in that too, because they're asking these same questions and reporting that to us to that. So it's going to be very comprehensive, and I hope that we can share more information with you in the future. And I think we can acknowledge if we make a mistake, we're going to talk about it, and if we can learn from it. Or if we did what we could, and that's what we're going to report. So that's that part about your reporting on Denver Health, that issue. In our transitionary discussions, me and Murphy have, he's left me with a few things, that we've talked about. And this is something, a torch he's passed to me that says, hey, here's something that we need to address that he has been addressing. He has been asking the hard questions of our emergency medical response system and how we're doing things and how we're, learning about these things. So yes, that's something that we will continue to look at. I will continue to look at. And as I, post confirmation, hopefully, and post going into this, I'm going to really look at how are we adequately putting oversight on that process to make sure things like this do not happen.
Yeah, with regards to the Denver Lakewood shooting that we all just experienced, the tragedies that occurred as a result of that. Only thing I would add, because everything Armando said is absolutely on target and I'm aligned with. Only thing I will add is what was our communication and how can we improve that communication with the federal government if there are challenges there? Because obviously we know that they also were looking at this individual simultaneously and had some interest there. So I think there's a lot that we can look at, and the broader we can keep it, Tony, the better, to give us the information we need so that we can try to prevent this sort of thing from happening in Denver or in the metro area. Again, that's our overall objective. Two, with regards to EMS, you know that this has been an area of interest and concern of mine for 2 decades now. We've worked a long way back on this issue. Anything that would improve services to the people of Denver, we have to be interested in. And if there's concern about EMTs being ordered to bypass other urgent care centers or slow response, I think we ought to know that, and we ought to work to improve it as quickly as possible. So this investigation or review, let's call it that, needs to take place. Let's take a look at it, and then let's get better. Let's improve services for the people of Denver.
Thank you.
Tony, that okay, Tony? All right, great. Anybody else that I didn't get to? And certainly there will be opportunities to talk with Armando after this press conference, and they will be facilitating that as well. But if there's any additional questions before we say goodbye, please say them now.
This is Elise from the Denver Post. I have another question. Armando, you mentioned, obviously rising crime that we're seeing here in Denver. What does Denver Public Safety or DPD need to do differently to address this rise that we're seeing?
Yes, thank you. That's the $1 million question. What do we need to do differently? And what we're currently doing is our best, and we're doing what we can. But the good thing about Denver, and like the mayor said, we're a model for others because of our innovative strategies that Denver has historically done in the space of public safety, like STAR and things like that, and alternative response. But I spoke with the chief recently. He understands, and he definitely knows the crime is a significant issue for us all. I can assure you that the police department and this office is working at anything and everything that we can do differently. I talk about that intersection with public health. What we don't want to do is say, well, let's just start arresting everyone again and cycling through a system, because that's not going to work. That's not going to work, just putting everyone in jail and then cycling them out of a system. What we find is just let's try to have those interventions where we bring the right resource to that. So if it's a drug problem, if we're someone experiencing a trespassing issue, but the underlying issue is someone's mental health or drug problem, let's get them those resources as opposed to just taking them to jail for the night, to where they're coming out there the next day for the officer to encourage. So really trying to provide everyone with the resources that we can try to get, especially high resource utilizers in our city, folks that are frequently in and out of our jail, really try to get to those interventions that can prevent further criminal justice involvement.
Let me jump in here, because I think this is a very important point, Elise. Your question is a critical one for all of us, and I'm talking about all of Denver. And after almost 30 years of public service, I can tell you that by the time we turn to the police to solve a challenge, we're already late. By the mere structure of and theory of policing, it's a reactive model. We are trying to change that paradigm a bit in Denver and being more proactive, particularly with non-police resources. But the reality is that, by the time someone commits crime, we've seen the indicators in terms of the community in which they live, the obesity rates, the school completion or attainment rates, the poverty rates. We've seen a parent has seen something, a friend has heard something. We as a community as a whole have to work to solve the challenges of crime that we're seeing. We know a sibling's involved with drugs or addicted to drugs. We know we have a brother or sister who is angry about something and is already out there talking smack on social media. We know a friend is on social media doing X, Y, and Z. Before something happens, we are seeing the indications. And so that's a great answer by Armando, and really a public safety expert or a professional's response. But he also knows, and I can tell you this with every public safety professional I've talked to, by the time they get involved, we are already too late. We are seeing the statistic climb. And so my conversation with the community is we all have to play a role to help solve the crime. We all have to be willing and courageous enough to speak up. and to raise and to pull alarms when we know things are about to go down or we see the embers of potential challenges and crime being committed. 96% of all crime can be prevented if people spoke up. And that's what we as a community have to harness and really react to. So I hate to jump in there, but this is something that I'm becoming real passionate about, because the more and more we look to government and police to solve the problems, the further and further we get behind and the more we see our numbers go up.
Great. Thank you, Mayor. And thank you all for joining us. Any last words,
Thanks
Mayor?
all. Thank you all. We're excited for Armando. We have a tremendous professional, and I'm glad he was already on the bench ready to go. I think you're going to find someone who was uniquely prepared for this job. Thank you, Armando.
Thank you, everybody. Take care.